Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today's Thursday, July 15th, giving you the update from Albany Med. All right, Fred, it's been so long, I almost forgot how to say that.
I know. We have had a little hiatus here. My fault, I was away last week.
Well deserved.
A little R&R.
Well deserved. First graph, let's look at New York State, people in the hospital with COVID. There's 349 in hospital beds throughout the state. This is remarkable because actually that number for New York State is lower than the high water mark in the capital region.
I knew you were going to say that.
Isn't that
That's
wild?
Right. That's wild.
Is that wild?
Yep.
So great news in New York State. And Fred, you can update us on national numbers in just a second.
Yes.
Let's look at the next graph here. Capital region, 12 in the capital region. So a number that's come down from a high water mark over 550. Admissions and discharges to the medical center. This is interesting. If you focus here, you can see now we sometimes have multiple days in a row where we may have no admissions.
That's right.
Multiple days. And then here's the morning census at the medical center. We currently have 3 in the hospital diagnosed with COVID, 2 on the floor, 1 in the ICU, none on ventilators. But of the 3, there's actually another number inside that's pretty remarkable. So what is it, Fred?
And that's 0, Dennis. None of the 3 are infectious. They're all past that active stage of the disease.
So would I be correct in thinking that this is the first time in probably 17 months
17 months,
when
Dennis.
we didn't have anybody in the hospital that were actively treating for COVID?
That's right, Dennis.
Right. So Fred, now compare that to what some people may be watching the news. There are some places around the country, certainly around the world, where the story is not as good.
That's right, Dennis. So I think everybody's been hearing this on the national news that the number of cases are going up around the country. So the low water mark was around June 20th with about 11,000 new cases a day happening at that point. More recently, this week, we're up to about 25,000.
Okay.
So a little bit more than doubling. So that's being driven particularly in areas with low vaccination rates, which is not what the capital region is.
We're very proud. We have numbers that are very high.
That's right. And so we haven't seen that kind of escalation.
Tie that national picture, those hotspots, into variants as well. I know there's some talk about variants.
So variants now nationally, the Delta variant is a dominant variant.
Okay.
And again, that's not the case here. So actually, I have some numbers here.
Share them with us.
So the Alpha and the Delta variant. So Alpha was the UK,
right.
The Delta is the more recent. So the Alpha variant peaked in May at 70% of the isolates that were tested at Wadsworth for New York State. And that same month in May, the Delta variant was 2%.
Okay.
More recently, the Alpha variant has dropped a little bit to 56%, and the Delta variant's 13%.
Okay.
But that's still less than what's being reported nationally, that over 50% number nationally.
So the Delta variant is the dominant strain. We know it's more infectious. Question that people ask, I know we've asked and answered before, let's do it again. Does the vaccine still protect against the variants and the Delta variant?
Simple answer, yes.
Okay,
yes,
very good.
It does.
So we still encourage that, and in fact, even more so with the variant on the rise.
And Dennis, someone might be out there and say, well, wait a minute, I've heard that people who are vaccinated have gotten infected.
Right.
And it's important to remember the vaccines are not 100% effective.
We talked about that.
They're 90%, 95, 97% effective. They have really high efficacies, but not 100%.
So let's use that then and segue into another topic which has been in the news recently. So we do know that Trinity, which is a national system of health care providers, hospitals, has mandated the COVID vaccine for its workforce.
That's
and that was in the news last week. We weren't able to talk about it then, which leads to the obvious question, will Albany Medical Center Hospital require the COVID vaccine? We've talked about this in the past. There's a process that we would go through to get to that decision. Fred, what is that process?
So Dennis, it starts with a group called the Infection Control Committee.
Yes.
Talking about this and basically developing a policy or a recommendation.
Okay.
That would then go to our Medical Executive Committee, which is made up of all the service chiefs, et cetera. A recommendation from there would then go to the board, and frankly, we would probably think about that or look at that at cabinet, at your cabinet before it went to the board, and then we would enact from there.
The process you just described is the same process that was followed 2 years ago
Yes.
when it was decided that we would make the influenza vaccine mandatory.
That's
So
right.
same process here. We're in the middle of that process right now. We're not making any decisions today. We're not announcing anything today. We're just telling people that is the process that's being followed.
That's right. And we expect to hear something from the infection control group
Okay.
soon. I will say, though, Dennis, my own personal, and this is my personal
Right.
bias, I think we ought to do this.
Yes.
I think it's in the best interests of our employees, our patients, and our community.
No question. All right, thank you, Fred. Let's talk about a recent announcement that the medical center made, a new chair of surgery, Dr. K. Marie King. Let me begin, Fred, and then you can pick it up from there. So Dr. K. Marie King will be starting here September 1st. She is a full professor of surgery. Her specialty is hepatobiliary surgery. So she's fellowship trained in the surgical discipline of taking care of people with injuries or diseases in the liver, in the pancreas, and the gallbladder. She is chief of surgery at Grady Memorial, which is a famous, very large academic level 1 trauma center, just like Albany Medical Center
Yes.
down in Atlanta. She's a veteran of the U.S. Army and
That's
served
right.
in Desert Storm and Desert Shield. So a remarkable career, but even more so than that, a very historic hire for the medical center.
So Kay Marie will be the first African-American woman chair of surgery at an academic center in the United States.
So you take sort of what I said, which is her curriculum and her resume and her incredible work, and you add it to that, and this is an incredible story.
Absolutely. Her background is just tremendous, Dennis. So she did her surgical training at UPMC,
Right.
And then went on to the Mayo Clinic for some specialty training, was on faculty there for a while. And her position at Grady is kind of an interesting one. It requires a lot of political skills to navigate 3 different groups of surgeons, the Grady employed, the Morehouse employed, and the Emory employed surgeons. So, and it sounds like from everything we've learned about her, she's done a tremendous job.
We've all met her. We certainly look forward to Dr. King coming here in September, and more to follow. I'm sure we'll have her on here as well. Fred, there was an article on the intranet page about a young man named McCoy Davis. I think that was his name.
That's right.
And if you have not had a chance to review it, it's a wonderful article. Fred, what was it about?
So this is a 12-year-old local child with sickle cell disease, and he receives his treatment here in our sickle cell program in the Melody Center, which is, again, one of the unique things that we provide for our community.
Yes.
So it was talking about how they've cared for this child and some of the benefits that he's received as a result of that.
Yeah. So for those who may not know, sickle cell is a disease that affects children as a blood disorder. Starts as a child. Obviously, some people will have dealing with it their entire life.
That's right.
Up at Double H, we have campers who come there where sickle cell is their medically qualifying condition. But the point you made, Fred, about how Albany Med is unique in the region, I would guess if you're someone with sickle cell, you get treated at Albany Med,
Yes.
probably starting in our Department of Pediatrics. And so, Fred, you said there's some recent science about this as well.
Well, you know, Dennis, it's interesting. It's a genetic disorder, very well characterized. Your hemoglobin genes are abnormal.
Right.
And so there's a way to change the genetic profile of the cells that become your red blood cells. And that trial is ongoing right now nationally. So if you receive those genetically modified cells, let's call it that, they reproduce in your body, and you no longer have the sickle cell syndrome.
Interesting.
Yeah, so I think we're
Fascinating.
still probably a year or two away from this becoming standard therapy, but it's really very exciting because it would be curative for these individuals.
All of us remember in medical school when you learn about sickle cell and you learn about the genetics of it and the substitution and how it evolved and why it evolved. It's got some deep roots in genetics.
That's right,
So,
Mendelian
exciting.
genetics.
Yeah. But most important thing, I guess, is great story. Read about that and read about the great work going on here treating people with sickle cell.
Absolutely.
Fred, it's Thursday, so we want to talk about length of stay.
Length of stay, so let's pop up the slide to look at length of stay. You can see we continue to drift down. We're getting into a better place. And the total and the length of stay minus the COVID population have pretty much come together,
Makes
as you
sense.
might expect. given the decrease in COVID patients. This, as we say every week, Dennis,
Yep.
is incredibly important. It's important to our patients to move them to the next venue of care that they need, as well as creating capacity for
Right.
others in the community that need our services.
You said one thing, you said it's drifting down. I agree with you. And I'd like to think it's actually moving down, meaning it's an active process. All the
It
things
is.
that you're asking the workforce to do in the hospital to be more efficient, to make active decisions, et cetera. So it's moving in that direction, but not passively.
That's right.
It's moving in that direction.
Absolutely right. You're absolutely right, Dennis. It is 100 things that
Yeah.
we do differently every day
Yeah.
or more
Very good.
that allows that to continue to move down.
All right. Matt Markham is out there. He's hiking the high peaks.
You're jealous.
I am very jealous.
You're jealous.
We look forward to him coming back. We thank everybody who's going to be working here this weekend,
Yes.
24/7. That's why we are the medical center and the hospital that we are, because we can provide that care. And we'll be back again next week.
Next week.
All right. We ask that you once again please take care of yourself, take care of each other, and we'll see you next week.